Hypertension is a very common health issue. In the United States today, it's estimated that over 72 million people are diagnosed with high blood pressure. High blood pressure can do damage to your body for years before symptoms even begin to be noticed. So it's very important to know if you have it and to treat it. I'm a nurse and I currently work at Fauquier Health and Rehab. Taking blood pressures is something I do daily. I administer several medications which are designed to regulate blood pressure, but before I can do that, I have to check my patient's blood pressure to make sure it falls within the parameters that make it safe to give the medication. Also, an abnormal reading in a patient is usually a good indication that something might be wrong. So today I'm going to show you how to take a manual blood pressure, and I'm also going to explain to you what a healthy blood pressure is and what those numbers actually mean. So, what you will need, before I get started, I'm going to show you what you need. And I'm going to use a regular arm cuff and a stethoscope to do this. According to the American Heart Association, a healthy blood pressure runs about 120/70. These guidelines changed within the past few years. It used to be 120/80. And what those numbers actually mean is the systolic, which is the 120, is your high number. And that is the pressure in your arteries when your heart is actually pumping blood out of your heart through your veins. That's your 120. And the other number, the lower number, is your diastolic blood pressure, which is the pressure in your arteries when your heart actually relaxes and refills with blood. So I'm going to get somebody to help me and show you how to do this. This is Nathan. So I'm going to take my blood pressure cuff, and some of them are different, but they usually have arrows on them that show you how to put them on properly. So the first thing I'm going to do is I'm going to locate his brachial pulse, because that's where I'm going to place my stethoscope. So on the inner aspect of his arm is where I feel it the strongest, so I know that's where I'm going to go. So I'm going to slip this. This one's a little bit different than the one I use usually. Slip this over his arm, and I want my arrows to kind of line up with his artery there, where I felt that pulse the strongest, which was right about there. And this is my meter, and I'm going to clip it right here so I can see it. And this is my pump. I want to make sure it's closed. I have a little knob here that opens and closes it. You want it closed so you can pump it up. And then I'm going to take my stethoscope. I want to have my ears pointing forward so I can hear properly. And then I'm going to place this over his, where I felt his pulse the strongest, or in his arm. And I'm going to pump it up to about 200. And then I will release the pressure. And what I'm going to be listening for is a thumping sound. I'm going to be listening for when I first hear it, and that's going to be my systolic. And then I'm going to listen to that sound until I hear it no longer, and that's going to be my diastolic. And Nathan's running about 122/80. So that's pretty good. And that's about it. I like this method because I think it's the most accurate. If I ever am at work and I get an abnormal reading, high or low, on a Dynamap or a radial cuff or anything that I'm using, I always back it up with a manual blood pressure because I think it's the most accurate. So today I've shown you how to take a manual blood pressure, and I've also explained to you what exactly those numbers mean and why it's important to know if you have high blood pressure, because like I said, it can go undetected for years, and then by the time you actually realize you have an issue, it can be too late and you can already have a serious problem. So I hope this demonstration's been helpful, and I appreciate you watching. Thank you.